Baldwin. I'm a clinical geriatric pharmacist and I work for Resources for Seniors. And today I'm going to talk about anxiety and an anxiety disorder. So, what is anxiety? Anxiety is a feeling of worrying and nervousness about an event, about something, about a trigger, usually. And anxiety itself is a normal part of life, and it can be present during specific periods of stress, such as exams, a stressful event, marriages, funerals, buying a house, death of friends or families. You can develop anxiety because you have to give a performance or a presentation. You could have anxiety because you're worried about having to do something and being rejected by your peers. New relationships that are ending, and even financial hardships are all ways that we normally see anxiety pop up in general. And what makes an anxiety disorder different, though, is that anxiety is consistent, it's persistent, it's all the time. It's out of proportion to what the stress is, or what the stressor is. For example, if you are stressed because you have to go to the bank, and that's a normal stress in today's day and world, but now that anxiety eats at you and eats at you and eats at you and prevents you from going out and you're uncomfortable and you hit the car and you just freak out. That's where it crosses over from being normal to an abnormal and out of proportion. And an anxiety disorder interrupts your daily function. And persistent means that anxiety is there, constant for several months. And it just means that it is excessive, and it literally can interrupt your home life, it can interrupt your work life, it can interrupt your social life. And now, in today's day and age, when we're all trying to socially distance and stay at our house, that anxiety can be made much worse. And collectively, anxiety, using the phrase anxiety disorder, refers to a collection of psychiatric disorders, which means separation anxiety. That often happens when you have little children who have to get handed off to someone they don't know, and they're being separated from their mom or from their dad. That can give little children separation anxiety. You can have a specific phobia of fear of public speaking, or socialized anxiety disorder, or a seasonal affective disorder, or you have a generalized one. You can have a panic disorder. You can have agoraphobia, which is where you are afraid to step out of your house. And in today's age, there are lots of individuals that are developing or have minor agoraphobia that are so afraid to leave their house because of what's out there. And then if it's none of those, there is indeed something called generalized anxiety disorder. And anxiety disorder can also be associated with other disease states, such as hyperthyroidism. That's when your thyroid produces mass amounts of thyroid hormone, which can cause a rapid heart rate and just feelings of uncomfortableness. If you have angina or a heart attack, because you can get palpitations in your chest and you can get uncomfortable, and you can have respiratory disorders such as COPD or asthma that can also cause shortness of breath, which can precipitate an anxiety disorder. There are other things such as substance abuse or medication-induced anxiety disorder. That would be cocaine, for example, is a substance abuse, or alcohol withdrawal can cause anxiety. There are other things such as caffeine, coffee, that can also give you, as you withdraw off of caffeine or have too much caffeine, that can stimulate anxiety. There's also something called an illness anxiety disorder. So something I always teach the learners that I work with and other seniors that I work with is you want to know how common an anxiety disorder is in older adults. Anxiety disorders are often diagnosed in children or in young adults. And what happens if they're left untreated, it can become a chronic that waxes and wanes. And we used to think that anxiety often declined as we got older. And unfortunately, that's not true. We know anxiety disorders seem to be pretty consistent. As we get older, We report physical symptoms more, such as my knees hurt, my legs hurt, my back hurts. And we report psychiatric symptoms such as I feel depressed, I feel slow, I feel anxious. We report those symptoms less and less. So it's harder to diagnose. And also mental health issues historically have been more stigmatized in past ages, and we're now starting to speak more and more about mental health issues. The most common anxiety disorder in older adults is a generalized anxiety disorder, also noted as GAD, and that is the most common anxiety disorder among older adults. And women, we are twice as likely to have anxiety disorders as men are. And everybody always wants to know what causes an anxiety disorder. And the bottom line is we don't really know. There is some genetic component, so it has a tendency to run sometimes in families because it can be inherited. And then there are risk factors, child abuse, physical punishment, if you have a parent who has a mental history of a mental disorder, and again, just being female. Then why does it worsen as we get older? And anxiety sometimes worsens, sometimes stays consistent, and sometimes does not worsen. It's very individual specific. So it could get worse depending upon, again, death of a friend or family. You know your end of life is coming and you get very anxious about that. You get worried. As we get older, it's not uncommon for people to slow down, and that decreased mobility, the decreased ease of getting out to go do the things that you like to do can cause anxiety. People start to become, when normal comes back, the older we get, we have a tendency to be more isolated. Being more isolated and alone with our thoughts, with our fears, gets worse and it gets louder, and that anxiety can overtake us. And then again, there's just some common medical disorders that can increase your likelihood of developing anxiety as you get older. Those can be urinary incontinence. You're anxious because you don't want to go out and have a urinary accident or inadvertently leak urine over yourself. Or you have had a prior fall and you get anxious because you worry that you're going to fall again. Diabetes can cause anxiety because your sugar can get too low, or you've had that low moment and you get worried about it. Breathing problems, because if you can't breathe well, you get anxious. And then there's just medical issues such as you were acutely sick, you had an infection, or you had a near-death experience. Those worsen anxiety, and those can make that anxiety disorder pop up or flare up. Now, overall, there are some overarching symptoms of an anxiety disorder. It's often fear, anxiousness, and then you avoid stuff. So there are often the perceived threats that start this process often vary between individuals. So what may set off my anxiety disorder might not set off somebody else's, or what sets off theirs might have not even trigger even close to my anxiety disorder. There's also restlessness. You feel an uncomfortableness, you don't know what, and you want to move. You don't sleep well. Your sleeping is worsened. You just feel on edge. You feel irritable with no reason. You get easily fatigued. You have a difficulty concentrating on the task at hand. Cooking, for example. You might try to be cooking a meal and get distracted because you just keep getting distracted. You feel muscles just tightening, and that causes pain. You feelings that you're worrying is beyond your control. And now, there are some unique symptoms that are very specific to older adults for the most part. A lot of older adults, when they start to develop anxiety, you get headaches. Older adults seem to have a lot more back pain and a rapid heartbeat if they're not taking certain medications to control that. And then their memory just seems to be worse. And that's the thing that we have to worry about is this anxiety causing this, or is this the development of mild cognitive impairment or something like dementia? And that's where a clinician's job is to come in to help learn the differences between them. But those are all some of the very basic symptoms of an anxiety disorder. Now, overall, we're going to talk a lot more about generalized anxiety disorder to try to cover everybody. And we want to talk about how it's diagnosed. And unfortunately, with the generalized anxiety disorder, it can also occur with other disease states, such as bipolar disorders, personality disorders, somebody who has a substance abuse disorder. Anxiety disorders, specifically generalized anxiety disorder, also has a tendency to run hand in hand with major depressive disorder. You can also see it with obsessive compulsive disorder, and even something such as post-traumatic stress disorder. All of those can co-run with a generalized anxiety disorder. But most times, we diagnose a generalized anxiety disorder is when a person has problems controlling their anxiety on more days than not over a 3-month period. You have to have at least 3 of the following symptoms. And again, these symptoms should sound familiar. Restlessness, sleep disturbance, just that feeling on edge, irritability, you're very tired, and you have difficulty concentrating, and everything seems tense. In today's day and age, a lot more clinicians are finding a lot more cases of anxiety because people are socially isolated. They're by themselves. They're afraid of contacting the COVID-19, and people get worried and they get anxious, and it builds up. And now, the true first-line treatment for most anxiety disorders are non-pharmacologic interventions or non-pharmacologic treatments. If you're interested in the non-pharmacological interventions for anxiety, go back on this channel and check out Dr. Lauren Deer's video on it, because she had a great video talking about the non-pharmacologic treatments for anxiety. So now, how do we treat it? The question we need to think about is, when treating it pharmacologically or with medication, does it make the problem better, or does it ultimately cause another problem? And that's what we have to think about when we treat. But if a clinician decides to treat someone for anxiety, they may use one drug or a multitude of drugs. And if it's a short-term anxiety problem, once the clinician and you find a drug that works and gets you to an appropriate dose, that a lot of times we will keep you on that dose for 9 to 12 months, and then we will consider tapering it off and discontinuing therapy, because these medications have issues that I will go through as I go through all of the classes. So the first line for generalized anxiety disorders, for most anxiety disorders, except if you have a certain type of specific phobia, if you're afraid of public speaking or if you're afraid of going outside, those have very specific treatments that I'm not going to go into. So for most generalized anxiety disorders, the first line treatments are antidepressants. And in that class, the physician would look at something called an SSRI, or selective serotonin reuptake inhibitor. Those are drugs like Prozac, you might have heard of, or fluoxetine, Zoloft, which the generic is sertraline, Lexapro, or escitalopram, Celexa, citalopram would be drugs that we would use. Those drugs, we start on a low dose. And in seniors, unfortunately, for most of these drugs, the anxiety benefit might not be seen for 2 to 4 weeks. So it takes time to be on the medications, and the physician is going to titrate you up slowly. Side effects of this particular class are very common: nausea. They can make you a little dizzy. They can make you drowsy. They can cause some insomnia and some other general disorder, some other side effects. They can cause you to bruise a little easier. So if you are on a blood thinner, you might notice more bruising or more bleeding if you go to brush your teeth. And the drugs that most physicians use in this class nowadays are Zoloft, which is sertraline, or Lexapro, which is escitalopram or Celexa. Those are the ones that seem to be used a little bit more frequently nowadays. We have good data. They have less side effects and more benefit for generalized anxiety. And they work particularly well if you have an anxiety disorder that is co-found with depression. Another class of drugs are the SNRIs, which stands for selective norepinephrine reuptake inhibitor. The big drug in that class that you may have heard of is Cymbalta. The generic for that is duloxetine. That's a unique one. A couple others in that class are Effexor, or venlafaxine, and Pristiq, which is desvenlafaxine. Common side effects are dizziness, insomnia, because they can make you feel a little more revved up. They can cause hypertension for big ones. Now, Cymbalta is a unique one. It has some data behind it that it can also help with nerve pain caused by damaged nerve from something like diabetes. So that's why I said you might have heard of that one before. Cymbalta is also once a day. It's got very good data, but that's another medication to use, and you have to be careful. It can indeed cause some insomnia. So conveniently, to treat anxiety for these first two classes, the dose for anxiety is often the same as the dose to be effective to treat depression. However, if you are using one of these drugs, such as Zoloft or Cymbalta, the anxiety doses, anxiety patients, people with anxiety seem to be a little bit more vulnerable to the side effects. So a good clinician who understands aging body mechanics would start you at an even lower dose of these medications than I would start a senior that has just depression. And we would take our time titrating. And again, these drugs, both of these classes, take time to get to an effective dose because you have to titrate up and then be on the dose, and then the physician will titrate you down. So it's a model that looks like that. Other classes that we can use are drugs called TCAs, or tricyclic antidepressants. The biggest one in that class that you may have heard used is Elavil or amitriptyline. And then there's also doxepin or nortriptyline. There's another class called monoamine oxidase inhibitors. We rarely use those. Now, there is absolutely evidence out there with these classes to help treat anxiety. It's very limited. So in this case, a clinician is going to look at how your anxiety is presenting. If your anxiety is presenting by the fact that you can't sleep, the physician may try amitriptyline, because amitriptyline is indeed an antidepressant, but it will help you fall asleep. It can cause severe side effects such as dry mouth, constipation, confusion, and it can cause problems urinating. Some of the tricyclic antidepressants can also cause heart-related issues, and it's this balance of how do we treat you best. These medications are often used in conjunction with trying to do sleep hygiene. Now, some of the bigger classes for anxiety are what are called the benzodiazepines. And those are drugs like Valium, Klonopin, Ativan, Xanax, or alprazolam, Lorazepam, clonazepam, diazepam. Those are all different types of benzodiazepines. Technically speaking, to be used appropriately, those medications should be considered second or third line options. However, most clinicians have a tendency to look at them easy because they can give a little bit more immediate effect to treat anxiety. But the benzodiazepines have data that say they can be useful for short-term anxiety or a long-term type of anxiety, but they are indeed controlled medications. So there is a potential, if used improperly or used excessively, that you can develop a dependence or an addiction to these medications. The benzodiazepines that are technically more appropriate for seniors are Lorazepam, a drug called oxazepam, which most people don't see used anymore, temazepam, and alprazolam. And it's because of the mechanics behind how the drug works once you take it in. They are a little shorter acting. They have a little less of the long-term side effects, such as the complete drowsiness and the fogginess that can happen. They also are very useful for when the anxiety flares up and gets overwhelming. They can be useful for anxiety like that. They can cause severe problems because they make you groggy. So walking increases your risk of a fall risk. Shouldn't drive on those medications. And again, they are addicting because they make you feel a little more relaxed. So the drugs, clinicians are struggling to find how to appropriately use these drugs in seniors. And the benzodiazepines can also cause what's called central nervous system depression, to where it makes it just a little harder to think, a little harder to function. Another class of medications are, for lack of a class, they don't really have a class listed, but it's gabapentin or Neurontin and Lyrica, which is pregabalin. They do have some benefit out there for generalized anxiety data, or generalized anxiety disorder, specifically pregabalin, which is Lyrica. However, these drugs can cause dizziness, drowsiness, nausea, they cause some blurred vision, headache, and a loss of balance. All stuff that we don't necessarily want in a senior patient because of the already higher risk of falls. These two drugs as well are controlled medications as well, so there is a potential for these ones to develop an addiction to. Neurontin, though, or gabapentin, has what's called a very huge dosing range. Depending upon the presentation of the anxiety, they could use as little as 100 milligrams a day on up to more than 3,000 milligrams in split up doses. So it has a wider variety, and Neurontin and pregabalin or Lyrica have uses for nerve pain as well, which for some clinicians make it useful because it gives extra added perk to why they're using that one. There are some physicians out there that will use some of the atypical antipsychotics, specifically Seroquel or quetiapine. It does have data out there for generalized anxiety disorder. However, it has side effects such as weight gain, increased appetite, dizziness, and drowsiness, and there is what's called a black box warning on this particular medication that says, actually for all of the antipsychotics, that says increased risk of stroke and death in elderly patients that have dementia. So I've noticed a trend of physicians trying to steer away from using the antipsychotics. There is another drug out there called Buspar or Buspirone that can be useful for generalized anxiety. It is not a controlled medication, and you can take it multiple times a day. Its side effects are, again, dizziness, drowsiness, can cause some insomnia, and some general restlessness. So a physician would look at your symptoms and try to match them up with these medications. Another thing that may be used is if you have anxiety that is made worse when you know you have to do what's called a performance. So performance anxiety, there's a drug out there called Inderal or propranolol, and that's mainly used because it slows the heart rate down, slows your breathing down, and decreases that cascade so your heart won't race. When your heart doesn't race, you feel less anxious. Now, just to go over something, there are some other things out there that can be useful. There's something that showed a small benefit of lavender oil, and it's a study out of Germany, and it said it helped in about a quarter of the patients use. And so that's all I have to do to talk about generalized anxiety disorder. If you have any further questions, you can either call Resources for Seniors at the number below, or go to their website, go to the Resources for Seniors website. Thank you for listening.